Welcome everyone. Thank you so much for joining us for this webinar on blood viscosity presented by Dr. Pushpa Larsen. My name is Dr. Leah Paz. I have the pleasure of working with Dr. Larsen here at the laboratory. A little bit about Dr. Larsen. She graduated from Bastyr University in naturopathic medicine, naturopathic midwifery, and spirituality, health, and medicine. She's worked as a research clinician for the Bastyr University Research Institute and as an affiliate clinical faculty for Bastyr University, training students in her clinic. Dr. Larsen is a regular contributor to Naturopathic Doctor News and Review and in the Townsend Letter for Doctors, and presents webinars on many topics in laboratory medicine. She practiced in Seattle for 10 years before joining Meridian Valley Lab as a consulting physician nearly 3 years ago. She consults with hundreds of doctors every year and on the use and interpretation of 24-hour urine hormone profiles and other tests offered by Meridian Valley Lab. I'm pleased to turn it over now to Dr. Larsen.
Thank you, Dr. Paz, and good morning or afternoon to those of you who are tuned in, and thanks for joining us. Today we're going to start with an overview of blood viscosity and how it's associated with diseases of aging. We'll go over the factors determining blood viscosity which are important in targeting treatment, how to interpret Meridian Valley Lab's complete blood viscosity profile, and briefly touch on anti-viscogenic therapies. And at the end of the webinar, I will answer the one question that we are always asked: how do I get a copy of today's slides? So let's dive in. So what is blood viscosity? These are just some basics so we're all on the same page. Blood viscosity is a measure of the thickness and the stickiness of blood. It measures how well your patient's blood flows. It determines damage to the blood vessels due to friction, how hard the heart has to work, and perhaps most important, how well the organs and tissues are oxygenated. Blood viscosity is considered by some to be the fifth vital sign. It is that important a marker of circulatory health. There is abundant research that ties elevated blood viscosity with a host of conditions, and it is something that can usually be modified easily with existing natural therapies. To understand how blood viscosity impacts health, it's useful to know a little about the physics of blood flow. Blood is considered a non-Newtonian fluid. Now, what does that mean for those of us who don't remember our high school or college physics? It means that blood is not the same thickness and stickiness when it's flowing fast as when it's flowing more slowly, unlike water. Water and plasma are Newtonian fluids because their viscosity doesn't change whether they're flowing fast or not flowing at all. And this is an important point because blood flow velocity is dynamic, changing within every cardiac cycle. Blood at high velocity, such as at systole, has a lower viscosity, and we'll see the reasons for that in a moment. Blood at lower velocity, such as at diastole, has a higher viscosity. In fact, blood at diastole can be anywhere from 5 to 15 times more viscous than blood at systole. We describe blood flow as being either laminar, which means in layers, or turbulent. Let me show you what I mean. In laminar flow, layers of red blood cells slide smoothly over each other with the fastest moving layers at the center. In turbulent flow, the blood forms eddies and slows down. The turbulent flow is damaging to the walls of the blood vessels because the flow becomes directed at the walls instead of sliding past them. In this illustration and the ones on the next slide, the velocity of blood in the carotid artery is indicated by the color of the lines or arrows. Red represents the highest velocity laminar flow with progressively cooler colors indicating decreased velocity. Purple, as you will see, indicates the lowest velocity and the greatest turbulence. The previous slide was a composite of the illustrations on this slide. This is taking place at systole, this particular illustration. And when I start the animation, you'll see the blood flow changes through the cardiac cycle ending at diastole. So there we go. So you can see that the blood flow is really quite dynamic. The direction of flow is quite dynamic. So with each cardiac cycle, blood viscosity is changing back and forth from higher viscosity at diastole to lower viscosity at systole and back again. So let's move on to how blood viscosity affects diseases associated with growing older. What happens to many people as they grow older? They develop high blood pressure. Many of them will have heart attacks or strokes. Many will become overweight or obese and develop metabolic syndrome, which actually may have been developing for years. Some of those will progress to diabetes, and some of those will develop complications of diabetes, such as macular degeneration, ulcers that require ulcerations of the fingers and toes that require amputation, or kidney problems requiring dialysis. Many people will have a loss of vision even if they're not diabetic, and or hearing loss. People are fatigued. They lose bone density, develop osteoporosis. Many will get cancer. And most will have some decreased in cognitive function, sometimes ending in dementia. Not a very pretty picture. So how is blood viscosity tied to these conditions of aging, or is it? You will see that blood viscosity plays a major role in many of the conditions we just listed and is exacerbated by others. So let's start with cardiovascular disease, which is the most obvious connection. Blood viscosity is the only biomarker that has been linked to all of the conventional cardiovascular risk factors you see here. It's a strong independent predictor of cardiovascular events, which means that it's one of the best measures, much better than cholesterol or C-reactive protein, for assessing how likely your patient is to have a heart attack or stroke. And it's been linked to cardiovascular disease in over 800 publications over the past 30 years, and the number of studies grows monthly. In their book, The Origin of Atherosclerosis, What Really Initiates the Inflammatory Response, Kenzie and Cho posed a number of critical questions about the origins, development, and manifestation of cardiovascular disease. Dr. Kenzie, some of you may know, was the developer of the AngioSeal. It's a leading device used in cardiac catheterization. He's no longer living, but he and his colleague, Dr. Young Cho, have been instrumental in the advancement of blood viscosity measurement technology. We are very fortunate at Meridian Valley Lab to be able to work with Dr. Cho's son, Dan Cho, who is a fountain of knowledge about blood viscosity research and technology. So the questions posed by Dr. Kenzie and Dr. Cho were, why are the arteries leading to the brain and heart so susceptible to atherosclerotic plaque? Why don't we see atherosclerotic plaques developing in the intramyocardial coronary arteries, which are buried in the heart, or in the arteries of the arms or the breasts or in the veins? And why, when a vein is used in an arterial bypass, does it arterialize and start developing plaques? If atherosclerosis is caused by a biochemical process, why is it region and site-specific in the vascular system rather than uniformly affecting all blood vessels? Why do healthy adults with normal blood pressure and cholesterol have heart attacks and suddenly die, often during exercise? Why do men develop cardiovascular disease at a younger age than women? And why are premenopausal women virtually immune to cardiovascular events? Dr. Kenzie and Cho Doctors Kinsey and Cho suggest that the answers to these questions lie in what they call the protective adaptation response. Just as these trees adapt to the constant force of the wind and therefore continue to live, atherosclerosis really develops out of a protective mechanism in the walls of the blood vessels. This theory hypothesizes that mechanical stress and injury produced by hemodynamic forces cause the endothelial cells to become dysfunctional, and that the body's adaptive response to mechanical stress and injury results in the development of atherosclerotic plaque. This really makes a lot of sense. Our body is always engaged in protective adaptations. Here are just a few of the protective adaptations the body undergoes in response to some kind of stress. And there are many more. So let's look more closely at why atherosclerotic plaques are not distributed uniformly throughout the vessels. We find them at branch points of large vessels closest to the heart where there's the greatest shear force and velocity. We also find them at places where shear force is high due to the additive force of gravity. Now here's another view of the cardiac cycle showing the blood flow patterns and differences in velocity at systole and diastole in the carotid artery. At systole, you have the greatest force at the point of bifurcation. At diastole, you have the greatest turbulent flow directed against the lateral walls of the artery. How does this contribute to plaque formation? Blood flows through the artery with the greatest velocity and force in the center of the vessel. Looking at this more closely, we see that this great force can dislodge endothelial cells. Viscous blood is abrasive blood, and so is more likely to cause endothelial damage. Turbulent flow, meanwhile, directs the blood against the walls of the artery proximal to the bifurcation, where similar damage to the endothelium can occur. As the stress continues, plaque begins to form to protect the artery. Okay, let's look at the relationship between blood viscosity and hypertension. In this large study, you can easily see the relationship between hypertension and blood viscosity. Both the diastolic and systolic pressures went up as blood viscosity increased. The highest quintile of blood viscosity was associated with the highest systolic and diastolic blood pressures. Blood pressure remained, this is important, blood viscosity remained independently linked after adjusting for age, sex, body mass index, social class, smoking, alcohol intake, exercise, angina, cholesterol, type 2 diabetes, plasma viscosity, fibrinogen, and hematocrit. So after controlling for all of those variables, blood viscosity was still the independently linked with both systolic and diastolic blood pressure. Now this is a very interesting study because it shows that even in a group of men, all of whom have hypertension, blood viscosity predicts cardiovascular events. This was a prospective study of 331 middle-aged hypertensive men, followed for an average of 4.8 years, and divided into thirds by diastolic blood viscosity. We're looking at event-free survival here. So these are the men with the blood viscosity in the highest third. The men in the middle third of blood viscosity had somewhat better event-free survival. But the men in the lowest third with the lowest viscosity, remember they all had hypertension, had the fewest number of events and the best event-free survival, and the p-value for this was 0.006. Smoking, which is strongly linked to cardiovascular diseases, causes up to a 20% increase in blood viscosity. This amount of elevation is clinically significant. Now looking at heart attacks and strokes, this is a large study of almost 1,600 men and women aged 55 to 74 years and followed for an average of 5 years. Their mean blood viscosity was adjusted for age and sex, and look at the p-value. The association with blood viscosity was stronger than that of smoking. And in this study of 430 patients, they were grouped into 4 categories: acute ischemic strokes, TIAs, other stroke risk factors, or healthy controls. Remember I said that a 20% increase in blood viscosity is clinically significant. A 20% increase in blood viscosity over the healthy control level takes it up to the level of those with stroke risk factors. A 25% increase takes it to 46.25, nearly at the level of those with strokes and TIAs. Okay, blood viscosity and blood sugar. This was a study of 1,400 people aged 35 to 59 years divided into quartiles by viscosity. Metabolic syndrome was highly associated with the highest levels of blood viscosity. And this was a prospective study, a very large prospective study of almost 13,000 people, initially non-diabetic adults aged 45 to 64 years, and they were divided into quartiles by viscosity. Those with the highest viscosity were much more likely to develop diabetes. What about cognitive function? So blood viscosity affects circulatory flow. It affects microperfusion to the brain, and it is significantly linked with cognitive function. In this study taken from the Edinburgh Artery Study, 452 randomly selected elderly subjects had both blood viscosity and cognitive function tests performed at 10 and 14 years into the study. The cognitive tests included logical memory, nonverbal reasoning, verbal fluency, and cognitive processing speed, and there was also a general cognitive factor that was computed. In 2002, De La Torre presented 9 types of evidence in a compelling argument that Alzheimer's is a vascular disorder characterized by impaired microperfusion to the brain. Number 1, epidemiological studies show that practically all risk factors for Alzheimer's disease have a vascular component that reduces cerebral perfusion. Number 2, statistical association between risk factors for Alzheimer's disease and vascular dementia. There is a statistical association. 3, improvement of cerebral perfusion is obtained from most pharmacotherapies used to reduce the symptoms or progression of Alzheimer's disease. 4, detection of regional cerebral hypoperfusion via neuroimaging identifies those at risk for Alzheimer's disease. 5, presence of regional brain microvascular abnormalities before cognitive and neurodegenerative changes occur. So there are microvascular abnormalities that precede cognitive changes. 6, there's a common symptom overlap between clinical Alzheimer's and vascular dementia. 7, there's a similarity of cerebrovascular lesions present in most cases of Alzheimer's and vascular dementia. 8, cerebral hypoperfusion typically precedes hypometabolism, cognitive decline, and neurodegeneration in Alzheimer's disease. And confirmation of the heterogeneous and multifactorial nature of Alzheimer's disease, likely resulting from the diverse presence of vascular risk factors or indicators of vascular dementia. So this is a really very interesting paper to read. I highly recommend it. And as I said, he puts forth a very compelling case. So let's look at just some other associations with elevated blood viscosity. These are not necessarily associated with aging, as you can see. And I'm not going to go into these any further right now, but important to make note of them. So what determines blood viscosity? There are many factors affecting blood viscosity, and as you can see, they affect the blood viscosity curve in different places. All of these factors either contribute to or are affected by one of 5 primary determinants of blood viscosity. And this is really where the rubber meets the road, because this is where our therapeutics can make a difference. I see that there's a question on the screen. I'm not going to take questions right now, but I will take them at the end. Just that's fine to go ahead and keep writing in your questions. So what determines blood viscosity? The 5 primary determinants are hematocrit, red blood cell deformability, plasma viscosity, red blood cell aggregation, and temperature. And although my graphic makes them look as though they all have equal impact, that's not really the case. It was just the way I did the graphic. So starting with hematocrit. Hematocrit accounts for about 50% of the difference between high and low blood viscosity. This one's pretty obvious, as the more red blood cells will result in more viscous blood than fewer red blood cells. Premenopausal women have naturally a naturally lower hematocrit because of their monthly blood loss, and this advantage is lost after menopause. The optimal hematocrit for men is around 42, and for women around 38. Red blood cell deformability. This is the second most important determinant of blood viscosity. Red blood cell deformability refers to the ability of the red blood cell to elongate for better hemodynamic flow, or to bend and fold for passage through capillary beds. The typical biconcave disc is seen under conditions of low viscosity, such as diastole. At high velocity, the red blood cell takes on a bullet or umbrella shape, presenting a profile that's favorable to laminar flow. And in the capillaries, the red blood cells form an elongated slipper shape that allows for passage through the very tiny blood vessels. So at low velocity, such as diastole and turbulent flow, red blood cells in the shape of biconcave discs are disordered like this. As they start to aggregate, this shape can form rouleau. At high velocity, such as in systole, red blood cells elongate into bullet or umbrella-shaped forms favorable to laminar flow. And in the capillaries, we have the elongated slipper-shaped forms that they interdigitate in rows to get through the capillaries. So what affects red blood cell deformability? Well, first, the age of the erythrocytes. Young red blood cells are more flexible and deformable than older red blood cells. This is another way in which menstruating women have an advantage. Because of monthly blood loss and the constant renewal of RBCs, premenopausal women have about 80% more young red blood cells and 85% fewer old red blood cells than men. Fluctuations in osmolality contribute to the stiffening of the red blood cells, and osmolality is in turn influenced by uncontrolled blood glucose. So blood sugar has a big impact on red blood cell deformability and therefore on blood viscosity. According to Paris Kidd, an authority on cell membrane health, deformability is a membrane property that roughly matches the membrane fluidity property. Factors that would lower deformability or fluidity include, but are not limited to, all free radical and other oxidant stressors, a category that essentially includes all toxins because these oxidize and then cross-link the membrane fatty acids to stiffen them up. Trans fats, hydrogenates, excessive consumption of saturated fatty acids, and predictably just about any factor that can cause stress to the body. Factors that support deformability or fluidity include omega-3 fatty acids, DHA much more so than EPA, which is not very present actually in human cell membranes. Monounsaturates like omega-9s, omega-6s like GLA, all the membrane antioxidants which include the curcumins, and non-membrane antioxidants that combat oxidative challenge, such as glutathione and other water phase antioxidants and antioxidant enzymes. Dr. Kidd says, bottom line, we are only as healthy as our cell membranes. And as a rule, the more fluid and deformable our membranes, the healthier we'll be. I'm sure this applies to more than just red blood cell membranes. Pardon me. Plasma viscosity is primarily dictated by two factors. Hydration, makes sense, right? And the concentration of plasma proteins, particularly high molecular weight proteins such as immune globulins and fibrinogen. This explains why anything that increases these proteins, such as autoimmune disease, also increases blood viscosity. Red blood cell aggregation. So at high velocity, cellular components in fibrinogen are dispersed. At low velocity, fibrinogen interacts with red blood cells, contributing to aggregation. And the red blood cell aggregation and plasma viscosity are very closely linked, and there is a lot of interaction. It's kind of a complex process, so I'm trying to make it simple here. And then finally we have temperature. And as with most fluids, blood flows more easily at higher temperatures. It's estimated that a 1% increase in body temperature results in a 2% decrease in blood viscosity. So how do we test for blood viscosity? Well, this is the old methodology. It uses something called a Brookfield viscometer, which was developed for testing the viscosity of house paint and engine oil, both of which are Newtonian fluids. Using this technology yields a single measurement that is roughly equivalent to blood viscosity at systole. Remember, blood at systole can be anywhere from 5 to 15 times less viscous than blood at diastole. And this is the new methodology. The most advanced technology is the Hematocrit viscometer, which measures the entire dynamic range of blood viscosity. Meridian Valley Lab is proud to be the only clinical laboratory in North America that offers blood viscosity testing with this state-of-the-art technology. Now you can see there that it measures 10,000 shear rates. And if we gave you 10,000 values, you wouldn't know what to do with it, nor would I. So we give you something much more useful. This is the complete blood viscosity profile. It has 3 sections. This is the blood viscosity section, which we'll look at more closely in a moment. This is a CBC, and then the interpretive section. The blood viscosity profile is read as 2 numbers, systolic over diastolic. So this test is read as 36.4 over 98.7. And this is actually really pretty ideal. Optimal for systolic blood viscosity is less than or equal to 40, and optimal diastolic is less than or equal to 100. Now I want to show you this report. This came in not too long ago. This is the complete blood viscosity profile of a 23-year-old male endurance athlete, so someone who stays very fit and healthy. And both his systolic and his diastolic blood viscosity were in critical high ranges, which goes to show that while blood viscosity is important in diseases of aging, younger people are not immune to potentially life-threatening blood viscosity problems. This is a more in-depth guide to interpretation of the complete blood viscosity profile with treatment guidelines for hydration, for use of nattokinase, and phlebotomy. Because this is a new test to almost all practitioners, we urge you to make use of the free consults that come with all of our tests, particularly for the complete blood viscosity profile. The consulting physicians here have been having regular conference calls with Dan Cho and Dr. Ralph Holsworth to make sure that we can support you in having this be a clinically useful tool in caring for your patients. Dr. Holsworth, by the way, is an international expert in the use of blood viscosity testing in a clinical setting, and is one of the people who brought this test to Meridian Valley Lab. So the specimen requirements are as you see here. Test kits are sent to healthcare practitioners' offices free of charge, and return overnight shipping is included. I mentioned at the beginning that blood viscosity can be treated with currently available natural therapies, and we're going to look at that a little bit right now. So our therapeutic targets are based on the 5 primary determinants of blood viscosity. We use those to guide us. We want to decrease hematocrit, improve red blood cell deformability, decrease plasma viscosity, decrease red blood cell aggregation, and optimize temperature, body temperature. So reduce hematocrit. The obvious way to reduce hematocrit in a safe and controlled fashion is blood donation, and this is kind of a win-win situation. The general guidelines at most blood banks are 1 unit which is about a pint, every 2 months. Red blood cell apheresis withdraws the red blood cells but returns the plasma to the donor, so there's no loss of plasma volume that would lead to temporarily increased viscosity. This is sometimes called double red cell donation, and it's not available everywhere. And then for patients who are unable to donate blood because the blood banks don't want their blood for whatever reason, there is therapeutic phlebotomy. This is an example of a protocol that's been developed by Dr. Holsworth, Dan Cho, and our lab manager, Janet Juntman. This protocol uses your patient's height, weight, hematocrit, and systolic and diastolic blood viscosity values to arrive at an appropriate monthly volume of blood to be withdrawn. that's assuming that your patient needs it withdrawn. As you can see, our fourth patient down there did not need to, it was not appropriate to do phlebotomy on that patient. You can see that the patient with the critically high blood viscosity values is still having only about 14 ounces of blood withdrawn monthly, or slightly less than a pint. And this is just under double what would be allowable in donating blood to a blood bank, where the limit is usually 1 pint every 2 months. So more typical is for 3 to 5 ounces a month. And if you do the blood viscosity profile with us, this is something that we can help you calculate for your patient. Now, does donating blood really make a difference? Well, regular blood donors have an 88% reduced risk of a heart attack. And I want to show it to you a slightly different way, which I think brings the point home a little bit better. Non-donors had nearly 18 times as many heart attacks as blood donors. And look at the p-value. Oh, there's the p-value, 0.0001 for the difference in proportions. Okay, so that's hematocrit. Now let's improve red blood cell deformability. Want to use correct lipid nutrition, or correct their lipid nutrition using DHA, omega-6s and 9s. And phlebotomy again. Now, why would phlebotomy improve red blood cell deformability? Well, remember, young red blood cells are more flexible than older red blood cells. So regular donation helps your red blood cell flexibility as well as reducing your hematocrit. And remember all the things beyond good fats that can affect membrane flexibility. Antioxidants are important, and the dark red powder over here on this side of the screen is called astaxanthin, and it's a unique membrane antioxidant that has both hydrophilic and lipophilic sections and fits very neatly into the phospholipid bilayer. And it doesn't get depleted and doesn't become a pro-oxidant itself. It's particularly plentiful in shrimp, crabs, and lobsters, and probably some other things, but that's what I remember at the moment. We want to improve blood sugar control. Remember that fluctuations in osmolality can cause stiffening of the red blood cells, decreasing their deformability. And both diet and herbs such as berberine are important in this. And of course, detoxification. Next is decreasing plasma viscosity. Well, hydration is, of course, very important. It's key. Adequate hydration can move the entire blood viscosity curve downward. So that's something that you want to stress, as you probably already do with your patients. And then use all the tools you have for decreasing inflammation and decrease excessive immune globulins by identifying and eliminating food allergies and sensitivities, as well as detoxification. All those things that you know how to do. I want to go back to hydration here just for a moment, because some patients will actually need to be hydrated with IVs because they are so dehydrated. So normal saline, 6% hetastarch, actually I'm not sure what that is. I think that's something that Dr. Holsworth has recommended. Also reduced alkalinized water. Dr. Holsworth says it's used in Japanese dialysis units, and we've done one small study and are in the process of another one using reduced alkalinized water in rehydrating firefighters and looking at the effects on their blood viscosity. And the studies are very interesting, very promising so far. Also, niacin can help decrease plasma viscosity. We want to decrease red blood cell aggregation and sedimentation. And we know a number of things to do that. Nattokinase, lumbrokinase, Wob enzymes, so proteolytic enzymes, phosphatidylcholine perhaps. And I'm sure there are those of you out there who have your favorite things that you like for improving, decreasing platelet aggregation, decreasing red blood cell aggregation. So these are just a few. I don't intend or expect this therapeutics section of the webinar to be exhaustive. I figured this is the part that you guys know the best, and I want to give you the information about why you want to use those things you know the best. And then last but definitely not least is optimizing body temperature. So you want to treat hypothyroidism, treat hypoadrenalism, which can also cause a low body temperature. We can use constitutional hydrotherapy, which is very effective in raising body temperature. Saunas, exercise can raise body temperature, and there may be other things. So in summary, let's look again at that list of conditions that are associated with aging and see how blood viscosity is related to each one. So hypertension, heart attack, stroke, that's pretty obvious. Weight gain and obesity. Well, there's clear evidence that obesity is associated with elevated blood viscosity. This may be because the things that contribute to weight gain also contribute to blood viscosity. Metabolic syndrome and diabetes, we can see, are direct contributors to elevated blood viscosity. Moreover, the dire complications of diabetes, ulcerations requiring amputation, kidney failure requiring dialysis, and macular degeneration leading to blindness are all primarily due to poor tissue perfusion as a result of the decreased flexibility of red blood cells. As a matter of fact, Dr. Kenzie said that all ocular problems are due to poor perfusion and elevated blood viscosity. This inspired me to see whether hearing loss might also be related to blood viscosity problems, and a brief PubMed search found 60-some-odd articles relating to hearing loss and blood viscosity. I haven't had a chance to do more than just a quick search. Fatigue. We could certainly understand how fatigue could be related to poor oxygenation of target tissues. Bone and joint issues. You know, the noted herbalist, Dr. Carrie Bone, has been quoted as saying that osteoarthritis is a problem of perfusion. That's another one I'd like to do a PubMed search on, see if I can find anything on that. But right now, I have a lot of respect for Dr. Carrie Bone, and if he says that osteoarthritis is a problem of perfusion, I'm inclined to go with that. We know that people with cancer tend to have elevated blood viscosity. That's very well established. Even when their hematocrit is low, because you know many people with cancer are actually anemic. But in this case, we're seeing cancer as a factor that contributes to the elevated blood viscosity rather than cancer being caused by the elevated blood viscosity. Cognitive decline and dementia are clearly related to perfusion, which can be improved by improving blood viscosity. Pardon me. So who should be tested? Well, anybody who has a history or family history of cardiovascular disease, hypertension, stroke, smokers, diabetics, and those with insulin resistance, people with inflammatory disorders, people with autoimmune disorders, anyone with a history of preeclampsia, intrauterine growth retardation, or miscarriage, because if they had those in their past, then they very well may have some elevated blood viscosity or a tendency towards elevated blood viscosity going on. Anybody with kidney disease? Men on testosterone therapy. Do I have that here? Yeah, there I do. Yes, people with autoimmune disorders. Men on testosterone therapy. Why is that? Because testosterone therapy, the most common side effect of testosterone therapy in men is an increased hematocrit. Now, this is not to say that people should not take testosterone. There are certainly many other benefits for it. But you do want to watch your patient's hematocrit and check their blood viscosity if they are on testosterone therapy. And then certainly anybody who is showing any signs of cognitive decline. So we want to treat the usual suspects, smoking, evaluate people for insulin resistance by a glucose tolerance insulin response test, and treat insulin resistance early and aggressively. Treat inflammation, detoxify, all the kind of good holistic, naturopathic, integrative medicine things that you would do just to improve someone's health is likely to improve their blood viscosity. So now's the time for your questions, and while you're typing them in, I know there's some already typed in. I'm going to give you a bit more information and tell you how to get a copy of today's slides. So first of all, if you are not already a customer of Meridian Valley Lab, I invite you to set up an account with us and try our tests. When you sign up as a new customer, you get 50% off our most comprehensive hormone panel for your personal use, or you can use that 50% off another of the tests that Meridian Valley does in-house, such as the complete blood viscosity profile or a food allergy panel. We also want to let you know that every test you do comes with a free consult with one of our consulting physicians. There are 4 of us on staff here, and we're here just to answer your questions about the best test to order for your patients and to help you interpret the results and recommend treatments when you get the results. And recommend treatments that help you get results also. So I promised you at the beginning I would tell you how to get a copy of the slides at the end of the presentation. So you're going to be getting an email from Meridian Valley Lab later today. Open it and click on the link to the webinar survey. It's a short survey, shouldn't take you more than about 5 minutes unless you have a lot you want to say. Complete the survey online and submit it. And as our thank you to you for your feedback, we'll send you a PDF copy of the presentation. Again, thank you for attending the webinar. Please don't forget to register for our next webinar. I'll be presenting on melatonin and oxytocin, the health benefits of good sleep and good sex. In case you're not aware of it, we have just rolled out our new 24-hour urine melatonin and expect to have a 24-hour urine oxytocin available very soon. And now I will take your questions. So let me get this. Oh, we've got quite a few questions here. Great. So question, okay, there we go. How is it that increased blood viscosity increases the likelihood of developing type 2 diabetes? I think it's actually the other way around. It's not that there is an association with increased blood viscosity and type 2 diabetes, but it seems to be that the elevated blood sugars, the more out of control blood sugars, are contributing to the higher blood viscosity because of the decreased membrane deformability or red blood cell deformability and possibly other things. There are a lot of factors interacting here, and with all of these diseases there are a lot of things that interact. So there may be a way that the blood viscosity itself is increasing the likelihood of developing type 2, but from my understanding of it, what we're seeing is that the diabetes itself is contributing to the increased blood viscosity. Question, what happens in the spleen as the shape changes? And I think the question is about the shape of the blood cells changing. I don't know the answer to that. A comment here, eat right for your blood type equals red blood cell aggregation. I'm not sure exactly what that means. I think what the person is suggesting is that using the blood type diet may be improving someone's blood viscosity. That would be an interesting study to do. Next question. Within what time period does the blood have to reach the lab after a draw? We need to run the test within 4 days after the draw, and that's assuming that it's been kept refrigerated. It should not be frozen, but the test kits have an ice pack in the lid so that it can be kept cold. If you send it back overnight, that should give us enough leeway so that we have 2 or 3 days actually even to finish doing the test, although we generally do them as soon as they come in. The only thing I would say is if it's a holiday weekend, don't send it on Friday. If we're not going to be able to get it until Tuesday, you're kind of cutting it short that way. But 4 days is the stability time for it. What is the name of the machine used for the test? Hematix, Hematix, and it's got some other numbers and etc. on it. I don't know the details about that. It's an interesting machine. Remember, I said the Brookfield viscometer that I showed you was developed for measuring house paint and engine oil. This one, because blood is dynamic, a dynamic fluid with different viscosities at different velocities, this machine uses a U-shaped glass capillary tube, and the blood is drawn up into one side of the tube, and then it's actually dropped, and it goes up across and up to the other side, and it equilibrates back and forth. It's really kind of fun to watch. I don't even know what all went into developing this, but it is very, very accurate. What is alkalinized water? Is bicarb added? I don't know if bicarb is added. I don't think so. But it does, alkalinized water has a pH of about, I believe it's 9.5. 9.5. And it's been treated in a particular way. The one I showed you on the screen is Essentia. That's one we use here in the clinic and in the dispensary. I know that there are others also. Here's a great one. Somebody says sex raises body temperature. Yep, so that's a good one for raising body temperature. What is constitutional hydrotherapy? Constitutional hydrotherapy is an old naturopathic nature cure therapy in which the person, I'm not going to go through the entire protocol. It's a little bit complicated to explain, easier to demonstrate, but you're using a series of hot towels and cold towels to do a contrast, and then having the body respond to the cold towels by heating up the cold towels. You wrap the person up actually after the cold towels are on, and it works really very effectively in raising the body temperature, to appropriate levels. And is really one of the best things I've ever found when somebody is coming down with a chest cold or pneumonia, has pneumonia or something like that. It works very well. It works great with kids too. A little bit complicated to explain the whole process, easier to demonstrate. But you can go online and you can look up constitutional hydrotherapy. I'm sure you will find some sites that tell you how to do it. Sometimes it's done with electrical stimulation also. It's not necessary to do that. Here's a comment: increased hematocrit alone is not an indicator of MI events. That's probably true. Because hematocrit is not the only contributor to blood viscosity. So, which is why we see men on testosterone therapy who have an elevated hematocrit, but their blood viscosity looks fine otherwise because they're doing other things to take care of their blood viscosity and their health. What does BHRT do to blood viscosity? Well, we know that testosterone can increase hematocrit, and so potentially can increase blood viscosity. But we also know that BHRT, bioidentical hormone replacement therapy, can be effective in helping prevent cardiovascular disease. So it's very likely that there are some effects of the hormones that are contributing to improved blood viscosity in some way. I haven't seen any studies on it. I can't really answer that question in any kind of definitive way. But I would not be surprised to find out that there are some benefits. Another interesting potential study. Okay. And also versus synthetic hormone replacement therapy. Well, that's a good question, because if you recall I can't remember the name of the great trial that was done, that they stopped it because they were finding an increase in cardiovascular events in women who were on hormone replacement therapy. Those women were all taking oral estrogens, and oral estrogens are, not only were they synthetic, not bioidentical, but they were also oral estrogens, and oral estrogens are known to increase the likelihood of clotting, of strokes, so it definitely is having an impact on blood viscosity in some way. Okay, let's see. Oh, Lindsay Berkson, hi, how are you? Slides indicated that nattokinase has no contraindications with medications. How about Coumadin? And how does Coumadin affect blood viscosity? Okay, that's another really great question. Dr. Holsworth uses nattokinase regularly with Coumadin and warfarin, and he actually says that it's much more effective at decreasing blood viscosity than warfarin. He's quote, I'm going to quote him. I think this is about right. I think he said out of 40 patients he saw who were on warfarin therapy, 39 of them, only in one of them, did their blood viscosity come down when they were taking the warfarin therapy. And how he explained it to me was that warfarin is very much like an additive that you would put in cement when you're mixing cement. So when you have cement, you have the concrete, you have the gravel in there, that's the aggregate, and you can put additives in it that will make it set up faster or slower. And the things that we usually think of as blood thinners, including aspirin, don't actually change the viscosity of the blood. What they do is they make it take longer to clot. And because part of the problem, part of the damage that's caused with the high blood viscosity is because the very viscous blood is very abrasive, so you're causing constant damage to the arteries as it's pounding against those bifurcations, and also as it's abrasive and it's going through those little tiny capillaries and scouring those capillaries, the capillaries respond by the basement membrane becoming thickened, which decreases the ability of oxygen to perfuse into the tissues. So blood viscosity, it's not just the clotting. The the clotting aspect of thicker blood that is a problem. It's actually the abrasiveness. So even though you can use something like warfarin or Coumadin and decrease the time, increase the time it takes the blood to clot, you're not changing how abrasive the blood is and the damage that's being done. Best form of niacin for reduction in plasma viscosity. I'm sorry, I don't know the answer to that. I can find out, and if you email us at info@meridianvalleylab.com and direct that question to me, I will find out. And here is a comment, lignans. I'm not sure what that means. It's just lignans, okay. Next question here. Do you accept blood from outside the USA, South Africa? Not at this time. There have been some problems even with Canada getting it across the border, and because it is such a short period of time that we have to turn it around, we're not doing it at this time because we don't want people to be wasting their money and their time sending us blood that is just not, the specimen's not viable for a blood viscosity test. Yeah, that's the answer to that. Is this test billable to insurance? We do not bill insurance here at Meridian Valley Lab. We do provide you with all the correct CPT codes, and then you as a practitioner need to provide the ICD-9 codes, and your patient can submit it for reimbursement. I don't know if this test is being reimbursed at this point. And somebody says, of course HRT extends life. Okay. But only if done right. Okay. Does having thinner blood from eating a plant-based diet, juices, etc., protect your vessels? Well, having thinner blood, having less viscous blood, for whatever reason, is going to protect your vessels. Is going to be, if less viscous blood is less abrasive. However, I think that there are a lot of benefits to be had in fish oil, in omega-3 fatty acids. You can get some of that from flaxseed oil, but the latest research I heard about how much of the alpha-linolenic acid in flax oil actually gets converted to DHA and EPA, it was less than 1%. Okay, I have another question here. Oh, Dr. Dixon, I won't be in Chicago, but Dr. Paz and Dr. Sawinski will. What else affects oxygen delivery from blood to tissue? Well, that's probably, we could probably do a whole webinar on things that affect oxygen delivery. Certainly, the exchange across the membranes in the alveoli, and I know there's some herbs that help with that. Cordyceps, for one. I'm being told that we need to wrap it up because we're getting towards the end of our hour. And I have a couple of questions here I haven't quite and don't quite understand. Hi, Dr. Merrifield. I have someone here says wheat will thicken the blood for most, if not all. That certainly is probably true for people who are gluten intolerant. And hemp oil is better, I am told, than something else, but I'm probably perhaps better than flax oil. I don't know if that means that any more of it gets converted to omega-3s, to DHA and EPA. Thank you for all of your questions. If you have any other questions, like I said, you can address them to info@meridianvalleylab.com. And I again want to thank my colleagues here, Dr. Paz and Dr. Kaplan and Dr. Sawinski, and Dan Cho, who is such a wealth of information, and Dr. Ralph Holsworth. I'm so glad he introduced me to this topic. So that brings us to the end of our webinar. I'm going to say goodbye and sign off.